Thank you very much. So I have two complications today, one that is my own and one that was referred to me. So I will first go through my own complication. So this patient, she's a 72-year-old female. She presented to me for resurfacing, and arguably, she's an excellent resurfacing candidate. She did tell me that she had ablative resurfacing about 10 years prior, and she had this odd, convoluted story about how she had this bad infection, this rash, maybe it was an allergy. It took her a really long time to heal. I tried to get her records, but the dermatologist had since retired, so I couldn't get the records. She also did have a recent concussion from a car accident, which did make me a little bit worried, but she was pretty with it and lucid for the most part. So again, from a skin standpoint, she was an excellent candidate for ablative resurfacing. Something was a little odd about her previous CO2 history, and she wasn't sleeping so well and maybe had some mild memory issues from her recent concussion. I did try and talk her, and I remember this conversation vividly. I remember I was at home, I actually had COVID, and I called her and I was like, let's start with a series of non-ablative fractional resurfacing, and we can always move to a CO2 or something more aggressive later on. But she really wanted to just move forward and be aggressive because she had the downtime, and she wanted the results. Something in my gut told me not to do it, but she convinced me it was going to be okay, so we moved forward. I did a relatively light CO2 on her, and on day 2, she was healing great. I start all my patients on oral antibiotics, oral antivirals, and appropriate pre- and post-procedure care. And on day 2, my worries started to fade away. She was healing great, the procedure went okay, she was sending me pictures, all was well. I told her to follow up with me in about 7 to 10 days. I do give all my patients, when I do CO2 resurfacing, my cell phone number, which I know some people do, some people don't. It makes me feel a little bit better. So she also had my phone number to text me if she had any concerns between now and her next follow-up. She didn't text me at all, and she shows up in my clinic about 10 days later looking like this. She should not look like this 10 days after a light CO2. I started to worry. So what did I do? I did a bacterial culture. It showed Pseudomonas, light yeast. I stopped the Keflex. I started Cipro. I added in fluconazole. I did a HSV culture. It was negative, but I continued the Veltrex anyways. And I had her come in every 2 to 3 days for check-in because she was overwashing. She was not doing appropriate at-home skincare, even though me and my nurses had repeatedly gone over how to do it gently and how to appropriately do the aftercare. But the nightmare continued. She continued to kind of scrub in between. Day 15, she wasn't looking much better, and day 17 was absolutely horrifying. At this point, I think I texted you, Dr. Rohr. I texted a lot of people this picture. I didn't know if I was missing something, what was going on. I was covering her appropriately. I recultured her. Nothing was really changing. But by day 22, she was starting to reepithelialize, but still quite horrific. And day 32, she was finally fully reepithelialized. But, my telogen effluvium had started. This was keeping me up at night. I was really worried about her. I was worried how this scarring was going to impact her long term. So what did I do? As soon as she was fully reepithelialized, I started pulse dye laser and non-ablative fractional with 1550 every month for 7 months. I started oxymetazoline for erythema and obviously strict SPF, and I had her follow up with me every 2 to 3 weeks just to make sure she wasn't doing anything crazy at home again. And this is her, about a year after her initial CO2. Not bad. I was worried she was going to have hypertrophic or atrophic scarring. She does definitely have some subtle color abnormalities still, but overall the texture is better than I could have hoped for, especially after that 17-day picture. And here is the other side. Again, arguably a fine result, especially from her baseline wrinkles. Not perfect, but better than I would have hoped, especially on that day 17 picture. So, what did I learn? I learned that I need to listen to my gut more. Something told me not to CO2 her, and I should have listened to that. And I also learned that patients who you are concerned about, usually I do about a 2-day follow-up and then a 7 to 10-day follow-up. You should be seeing the patients you're concerned about every other day in clinic if you do an aggressive procedure on them. I always make sure that we don't schedule CO2s when I'm going to be out of town, just in case something like this is going to happen. You really want to culture as soon as something starts to go wrong. Again, I don't think she got infected and that was the actual reason why she had this. I think it was her being aggressive and not doing the aftercare, and then she got secondarily infected, but still culture and cover appropriately. And then this patient still sees me. She refers her friends to me. She's not mad at me. We have a good rapport, and I think it could have gone in a very different direction if I wasn't nice to her and, cared for her in the way I did. Great. Moving on to the next case, which is not my own complication. This patient is a 39-year-old female. She presented to me 6 weeks after microneedling RF at an outside med spa. Pretty horrific. This was her forehead. She had these atrophic pinpoint scars on her forehead. She had atrophic pink depressed scars on the cheeks, and then they also did her neck, chest, and then her thighs as well. The thighs thankfully had no texture, but they were severely hyperpigmented and erythematous. So this was a picture she shared with me that was 2 weeks after her treatment, and then again, 6 weeks is when she finally found our clinic. So just a few facts from this case, which were quite horrifying to me. The contractor at the med spa did not have an active license. The patient signed a laser consent, not a microneedling RF consent, so she wasn't even appropriately consented for the procedure. The med spa was minimally responsive when the patient reached out and wanted their help in her recovery process. When she told them she was going to be seeking legal action, they said she couldn't sue them because the person who actually did the procedure was just a contractor at the med spa, which I don't think makes any sense. She initially went to a plastic surgeon in our area who then referred her to our clinic for laser treatment. And obviously the patient was extremely distraught with this. She did get a lawyer, but the lawyer told her that she couldn't start the process really until all of her laser treatments with me were done. So what did I do? I started with a vascular laser treatment, non-ablative fractional laser as well. I started compounded hydroquinone to the legs, and then we started CO2. I didn't want to start with CO2 even though I thought she would need it, so I wanted to see how she was going to respond and act, and make sure she could handle a more aggressive treatment. And then let me show you. So here's before, and this was after 4 CO2 treatments as well as some TCA cross. Not perfect, but definitely better. We've done about 2 more since then because she's going for as good as we can get it. Here is her before and after 4 CO2 treatments. Again, not perfect, but much better. And then her legs actually responded much nicer than I thought. So this was after non-ablative fractional in 1927, pulse dye, and a compounded hydroquinone cream. Thank you.